Doctors of Reddit, what are the dead giveaway signs that someone is faking? Answers. I went to emergency once with intense chest pain. The young, new doctor I saw first listened to my chest and immediately concluded I had pericarditis, but the supervising doctor decided I was faking it for drugs for some reason. The next morning I woke up to a psychologist in my room asking all sorts of random shit when an orderly interrupted because the ultrasound guy was in and wanted to see me first thing, I think after talking to the first doc I saw. Turns out he had pericarditis and myocarditis and the dude wheeled me out himself and told them order an ambulance to take me to a hospital with a cardiac clinic. My hubs had pericarditis, that pain is no joke. Doc said he had it in med school and was the worst pain of his life, 15 hours, 8K dead and they prescribed him ibuprofen 800. He has chronic stomach ulcers. Which he disclosed but they insisted that was all they could do. So, pain from the pericarditis or pain from ulcers, you choose. Edit, a word. Find a different hospital, don't transfer your medical history from previous doctors, clean slate. I found an amazing endometriosis doctor recommended on Reddit. My primary care docs recommended my current OB-GYN after my original ignored me saying I had vaginal bleeding for over a month and was in such extreme pain could barely get out of bed. Within 5 minutes of talking to my new doc he told me he thought I might have endometriosis. And we booked the surgery. Turned out I gave a pretty severe case of it in PCOS with my left ovary being the same size as my uterus and was at risk of bursting. So glad I finally had a doc take me seriously after a decade. When I was pregnant I developed a cyst about the size of a golf ball on one of my ovaries, it was clear on the ultrasound, doc said we'd keep an eye on it. Next ultrasound it was almost the size of a tennis ball, and was causing discomfort in certain positions. He insisted there was no way he could feel it. Couple weeks later had insane amounts of pain, and an intense burning sensation. Next ultrasound it was gone. To this day the man says it's impossible that felt anything, and that the cyst never popped, it just suddenly disappeared in less than a month. If I'll ever have another one, definitely not going with that hospital again. Some doctors I truly don't understand why they seem to be so dismissive of a patient's feelings and pain. 2 years ago I was so defeated by my pain that I legitimately felt suicidal and had to remind myself that hopefully this pain was temporary. My poor foolish thought. Thankfully with my second opinion, more like 7th gyno in 10 years, finally getting me a diagnosis I was pain-free for the first time I could ever remember. My pain is slowly returning. Chronic incurable illness does, and the emotional impact of my diagnosis still deeply affects me, but I have so much more hope now that I know we can be in less pain. And have found someone who takes me seriously. I pray you find a doc that will take you seriously as well, as cysts are so fucking painful and ignoring them can be fatal. In my case, I had been misdiagnosed with borderline personality disorder and it ended up on my medical record, after which it was pretty much impossible to be believed about anything. It was only with persistent help, letters from my therapist, that I was able to get it removed from my medical record, at which point my care returned to normal. Funny that. Needless to say, check what is on your file, and if there are errors, get them fixed. Ideally, the medical profession wouldn't be full of judgmental idiots who would disbelieve a patient based on a diagnosis like that, but you can't win them all. Yes, I recognize that it's not black and white and some people fake, but ignoring the person's complaints just because of a label on their file is absolutely negligent, and yes, I will die on this hill. Obligatory, not a doctor, but I got a call from my son's school nurse when he was in 2nd grade. And the conversation went like this. Nurse, sounding upbeat and cheerful, says, "Your son wants to tell you his terrible news." Son gets on the phone, says, "Hi mom, I cut my finger off." I ask him, "Where is your finger now?" "Son, I put it back on." I said, "Can I talk to the nurse?" Nurse gets on the phone again, says, "Sounds serious." Right. I asked, "Does he have a substitute teacher today?" "Oh, yes." I told the nurse to let him know we'll take him to the hospital for a shot for his finger. To which he says, "I think it's okay." I glued it on really good. Nurse kept him in the office for a bit to talk about scary changes in the classroom. I had a 360 testicular torsion and a doc thought I just had some inflamed glands due to my reactions. Luckily I came back after they sent me home or I would have lost my ball. 360 testicular torsion. Yeah, that's enough of this thread for me. I am in the middle of being treated like Elm faking and it's really frustrating. I had a tool slip at work and hit me in the eye and forehead. Knocked me out for a second and I lost sight in my eye. An hour later, I started getting my sight back, but it hasn't fully come back. It's been months now. Two things I got diagnosed with were ocular migraines and vitreous detachment and a concussion. But none of those things explain why my vision is still blurry in my right eye. Except the VD, which causes floaters, but my issue is blurry vision, like I have Vaseline in my eye. But doctors keep telling me I'm fine. That I need to go back to work. One doctor told me to think about the economy, and that I was lucky to have a job right now, so I quit my job. I still want to see out of my right eye, but none of the doctors are taking me seriously. This is going to sound dumb as fuck, but try going for a regular eye test at a high street optician's. Explain your situation and get the optometrist to have a look. They may be able to give you some specific language to throw at the ophthalmologist for things to get them to look into. Failing that, glasses could help. Agreed. I had recurring fainting spells with severe headache. GP eventually sent me to the hospital, who pumped me full of morphine and performed all sorts of diagnostic tests, but essentially said, no idea why this is happening. Sucks to be you. Went to the opticians a week later, and they explained the medication I was on was both expanding my pupils and making me hypersensitive to light. It was essentially acting as a multiplier to anything that might cause a headache or lightheadedness, lack of sleep, loud noises, getting up too quickly, in ordinary people. Got tinted lenses and the headaches and fainting disappeared almost overnight. Don't underestimate the value of a good optician. Get a vision test, and if you are lucky enough to have done one before in the last decade, then compare and take data with you to whoever you need to. My buddy kept having fits and went to the doctors, they told him it was epilepsy, gave appropriate meds, didn't help, so he goes back, oh right, sorry, it's diabetes, gives appropriate meds. He goes back, just keep taking the meds, it takes time. He then goes for his regular optician's appointment at Specsavers, they shine a light into his eye to examine the retina. The optician goes white and tells my buddy "T'll be right back," comes back with a senior optician who looks in his eye. Son, I don't want you to panic, but we're going to take you to the hospital, okay? A week later he gets 2 tumors. The size of golf balls removed from the front of his brain. If they had not been removed that week, they would have likely killed him. TLDR, you'd be surprised the shit an optician will find and a doctor won't. I'm a nurse on a floor that deals with a lot of chronic and acute pain patients. Most recent instance was this lady from a few weeks ago that was apparently splitting the oxycodone WWE were giving her in half in her mouth, and then when the nurses' backs were turned, she would stuff it in a pill jar. A night nurse caught her in the act and all of her shit had to be searched. We found 20 half tablets of oxycodone she had been stashing. She told us that she was saving them for her family in case they need them because it's just so hard to get an oxycodone prescription these days. I had her a few days after that, and she was having some abdominal pain, stat X-ray showed only gas. She just really needed to fart. But she was screaming, claiming it was a 10, and making a huge fucking scene. She demanded Dilaudid through her IV, and she wanted it to be pushed fast. Huge red flag right there. She wanted the high, not the relief. Doc straight up said he wouldn't give her Dilaudid because she was already on so many opiates. She then demanded lorazepam, still through her IV of course. Doc was like, fine, whatever, just one time and only a low-end dose. For real though, gas pain is no joke. I was once rushed to the hospital car as I knew I couldn't afford an ambulance, because I was doubled over in pain crying. I thought that something had ruptured or exploded. They weren't busy at all this night and got me back within 15 minutes of showing up. I don't like pills. Never have, because know I had an addictive nature when it comes to substances, so I just avoid them altogether. So they do their test and scans and the doc comes in and tells me it's just severe gas buildup. I'm in tears still. And ask the doc how the hell can gas cause this much pain and that it's gotta be something else. Doc says let me give you something and if that doesn't work we can try something else. I'm like okay cool because no way gas hurts this much. 30 minutes later I'm in the bathroom like I just spent an hour at Taco Bell. The doc comes in to check on me when I finally manage a free moment. I can't help but look dumbfounded. Since they weren't busy at all, he sat down and explained that since I have BS, I need to be more careful with my intake or else this could happen again. All the while I felt like a complete dumbass because gas had me in tears. I thanked the doc. He gave me some gas relief pills and suggested some diarrhea meds in case it happens again. I've never in my life been so sure it wasn't something only to be proven wrong. IBS can be a B asterisk. My first time experiencing it was at the first family day I joined with my then boyfriend. Terrible pain, we were thinking about going to the hospital because I was just bent double in the toilets. At one point I laid on my left side on the floor of the bathroom stall and the biggest fart comes out along with a huge relief. Everything was fine again and I felt super embarrassed. An X amount of time later I had to visit his GP with the same symptoms but to be sure it wasn't an appendicitis. Again IBS. Since then just assume it's LBS and take rest, try to get my bowels to move, etc. Since my uterus and ovaries are shut down it's way less so probably they added to the IBS pain too. My sister is a pediatric audiologist and this is my favorite story of hers. Apparently, sometime in elementary school, usually the early grades, a ton of kids like to fake hearing loss. Like not just, oh, I can't hear the teacher. Full on. Want to get hearing aids, etc. Anyway, she explained to me that based on the way she plays the tones, you can usually tell if someone is faking. Especially when they just pretend they can't hear anything. But it's not 100%, obviously, because hearing loss patterns can be really weird. However, she's caught a number of kids simply by saying, okay, so I'm going to play a random number of tones and they'll go in both ears. I want you to say yeses if you hear it and no, if you don't. However, she's caught a number of kids simply by saying, okay, so I'm going to play a random number of tones and they'll go in both ears. Want you to say, yes, if you hear it and no, if you don't. I mean, if I was told that I would definitely have answered no, if, say, I only heard the tones in one ear. Faking a hearing loss in one ear is common in children to explain why they do poorly at school, but can still follow conversation okay. Fortunately, we audiologists have our ways of telling if someone is faking a hearing loss, but particularly in one ear. Essentially the bone conductor, one way of delivering tones, and part of a standard hearing test, sits behind one ear, and most people assume that you hear the tone in the same ear. In reality, it vibrates the skull and is heard in whichever ear is the better ear. So basically, if you play a tone through a bone conductor placed on the right side, if that ear is deaf, you hear it in the left ear. So if someone tells you they hear tones only when the bone conductor is placed on one side, they're lying liars. I don't feel too bad sharing this secret here, because we have several other ways of picking out fakers too. My little brother actually is deaf on one ear, though we figured that out when he was still a baby. It normally doesn't impact him too much but he really does have a hard time hearing the teacher and has to have a speaker put near him connected to a mic on the teacher. I'm not 100% certain that's how it works. Anyways, apparently a couple other students, upon him explaining why the device was there and why he got preferential seating, announced that they, too, were deaf in one ear. My brother was young and naive. He was in third grade, I think, and came home to excitedly tell us that apparently there were other kids in his class with the exact same problem. When I had a stroke 10 months ago my biggest fear was I was somehow faking it and the ambulance ride was a sham and why was I doing it? No, it turns out was having a stroke. I was so worried I was being a faker although I have never done that before. Just a really odd mental state. This was me while going and in the ER for anaphylaxis. I genuinely thought I was there for no good reason, and that I was fine. Despite my entire face being swollen and not being able to catch my breath. I kept apologizing to the nurses for wasting their time once I could breathe again. When I was pregnant with my first child, I had a recurring thought that everyone is going to find out that I'm faking this and think I'm totally insane. How am I going to pull this off? T had this thought basically up until I gave birth, so, even with a huge stomach and baby constantly moving around in there. It was very odd. I have never and would never fake pregnancy. I don't know why anyone would want to fake anything medical. Unconsciousness in particular. I got a compound fracture recently and called 911 on myself and was put on hold. Fun stuff. But got through and asked them to send help. Operator was a badass and kept asking me questions to keep me conscious. The ambulance folks arrived, casually got out of the ambulance, walked up to me and then saw the bone sticking out of my body, and said, quote, "Oh. You're actually hurt. Yes. Did you think I called 911 because I spilled some lemonade?" Then it occurred to me that most of their calls must be horseshit. But to cause me even more confusion, I received close to a $2,000 bill for the privilege of actual help and the ride to the hospital. That ludicrous bill is no fault of the M's. I'm very much appreciative of their existence and they don't get nearly enough credit, but the best part of receiving that bill. The ambulance ride was roughly $1,850. The fentanyl they gave me was $2.15. The US health system terrifies me more than any illness. I can't imagine wondering considering the costs if I was injured or seriously ill. I moved to Australia from the USA and the medical cost anxiety has definitely followed me. My GP gently chides me now and then to come in if something is wrong. Preventative care is cheaper for everyone, but the mindset is hard to kick. Pretty much posted the same thing, it's a really hard habit to break, even when you know the cost isn't a problem.